A 68-year-old woman with a history of diabetes and hypertension who is recovering from a total hip replacement is given ketorolac, a non-steroidal anti-inflammatory drug, for the management of the pain. 24 hours later, her urine production decreases and her serum blood urea, nitrogen and the creatinine level rises to 44 mg per deciliter and 3.5 mg per deciliter respectively. What is the effect of this medication on the glomerular filtration rate, renal plasma flow and filtration fraction? So first let us pick some point that the patient is suffering from diabetes and hypertension, who is recovering from the hip replacement, and it is given by anti-inflammatory drug ketorolac. Okay, after 24 hours there will be decrease in urine production. When decrease, then definitely there will be a rise in the blood urea, nitrogen and creatinine. So whenever a patient is suffering from diabetes or hypertension, the blood vessels, they face a lot of resistance, a lot of pressure. For example, in case of diabetes mellitus, the osmolarity of the blood increases due to retention of the glucose into the blood vessels. So whenever more glucose into the vessel, definitely there will be more retention of water. When there will be more retention of water and plasma intravascularly, so the pressure inside the vessel increases. It exerts a high pressure on the vessel wall. If this condition kept for a long period of time, what happens? The vessel valve shows some structural changes and the valve smooth muscles become thick and some of the plasma protein also incorporated into the vessel wall. Because of that, the vessel wall becomes thick and the lumen becomes small. When the lumen becomes small, in case of this patient due to diabetes and hypertension, the lumen of the blood vessels providing blood to the kidneys, that is the renal arteries, the lumen becomes small. So whenever lumen becomes small, definitely then there will be less blood flow to the kidneys. When the blood flow to the kidney is decreased, there will be automatically decrease in GFR. The GFR also decreases. But there is a physiological phenomenon that there is a production of renin and there is a production of prostaglandins. Okay, the renin act and it activate the renin angiotensin aldosterone mechanism and it act on the smooth muscles and cause vasoconstriction. So the renin activate the angiotensin then act on the efferent arteriole. It causes what? It causes the vasoconstriction of the efferent arteriole. So the backward pressure increases. And number second, that is the prostaglandins. The prostaglandins is a hormone which is responsible for the vasodilation. So what it do? It act on the efferent arteriole. Okay, when it act on the efferent arteriole, it causes the vasodilation of the efferent arteriole. As it stenos, the lumen become thin, so it act on the renal artery and it causes the vasodilation. When there will be vasodilation, there will be increased renal blood flow, and when increased renal blood flow, then definitely the GFR will automatically rise up. So two mechanisms. Number first, the action of the renin on the efferent arteriole leading to vasoconstriction of the efferent arteriole. It increases the pressure and it increasing the GFR. And number second, that it increases the vasodilation effect of the efferent arteriole, When the efferent artery is dilated, more blood flow to the kidney, more blood flow toward the glomerulus, and the GFR, again the GFR is increases. So it is the physiological phenomena. But the patient having some sort of medication, that is the anti-inflammatory drug, that is the ketorolac. This ketorolac, what it do, it inhibit the prostaglandin synthesis. When there will be no prostaglandin production, okay, then there will be no effect on the efferent arteriole, so there will be no vasodilation of the efferent arteriole, so there will be decrease in GFR. The GFR decreases. Then when the GFR decreases, definitely there will be the retention of the creatinine and the urea blood nitrogen. So these two are the indication for the function of the kidney. So in this condition, the function of the kidney is declined, the function is reducing, and the cause is the medication, and the effect is inside the kidney. So it is the intrinsic phase, intrinsic cause of the acute renal failure. So let's go through the effect of this drug and see that what the drug did. So we choose the answer of this question. The number first MCQ is that decrease in renal plasma flow, decrease glomerular filtration rate, and no change in the filtration fraction. Number second, decrease renal plasma flow, increase glomerular filtration rate, increase and the filtration fraction. Increase renal plasma flow, decrease glomerular filtration rate, increase filtration fraction. So no change in, of course, no change. So the D and E is exclude these two options because they said that there is no changes, but here the drug is making some changes. So increase in renal flow, I think when there will be no production of the prostaglandins, there will be no vasodilation, so then there will be no increase in the renal plasma flow. There will be rather there will be decrease in the plasma flow. This is also excluded, this is also wrong. So decrease in renal flow, yes, this is right. Decrease in renal flow, of course, this one is right. Number second, increase in glomerular filtration rate, no, because when the flow is decreased, the GFR also decreases, so this one is also wrong. So the first question, decrease in the renal plasma flow, of course, when there will be no vasodilation, there will be less blood flow to the kidney, which leads to decrease in glomerular filtration rate, of course, and no change in the filtration fraction. Filtration fraction is means that the proportionate ratio between the decrease in GFR and decrease in blood flow. So it's a mechanism that whenever the blood flow to the kidney decreases, there will be decrease in GFR, and these two are proportionate to each other. So there we cannot say a net effect, okay, a net decrease. So there will be no change in the filtration fraction. So our option is A. Thank you.